Succes i veterinær praksis, podcast nummer 85. Søren Pejstrup her. Jeg er dyrlæge, og det er mig, der har succes i veterinærpraksis.dk. Det er et projekt med et nyhedsbrev, nogle online kurser, og så den her podcast, du lytter til nu, der alt sammen fokuserer på at levere komprimeret læring til danske dyrlæger. Og i dag, der skal vi snakke om de forsømte katte. Katte er ikke små hunde. Det er en sætning, du måske har hørt før, og det er også sandheden i dagens podcast. Så kattene har fået deres helt egen Diarré-podcast i dag, og jeg har været heldig at få en canadisk specialist med ombord. Hvis du synes, det her med Diarré-patienter er svært at få overblik over, og du gerne vil ligesom have et lidt hurtigt overblik, så er jeg ved at samle en hurtig pdf, som du kan downloade, eller rettere sagt, jeg vil sende den til dig på e-mail, så vi bytter for din e-mail, og så får du den her pdf, og den får du over på hjemmesiden, sammen med links og noter til det, vi snakker om i dag. Du finder det alt sammen på SIVP.dk/85, og så over til interviewet. Hi Kelly, and welcome to the podcast.
Thanks very much, Søren. I'm very happy to be here.
And thank you for being here. We met in Lisbon for a symposium Hills gave a couple months back, and we got it talking. And you told me that you're an expert in cats, so I thought, yes, that's a good that's good for the podcast. So thank you for coming on and taking the time to talk to us.
You're very welcome.
Will you please give us an introduction to who you are and why you know so much about cats?
Sure. Okay. I'm a Canadian veterinarian, and I've been a veterinarian for 20 years now. But I'm also board certified with the American Board of Veterinary Practitioners in feline practice, and I've been doing that for about 5 years now. I own my own cat practice in Ontario, Canada, and that's been open for 11 years. So I work exclusively with cats for at least the last 11 to 15 years.
Yeah. We're going to talk about GI cases, or maybe diarrhea more specifically. Of course, some of these cats will vomit as well, but maybe you can give us an overview of what we are going to expect here. What kind of cases are we going to talk about?
So I think today we're planning on talking about mainly diarrhea, but as you indicated, with gastrointestinal problems, we're going to see some cats that also have vomiting. But diarrhea is actually an interesting topic in cats because it can be a very frustrating case to deal with, especially without diagnostics that may provide us with answers. And a lot of cats carry a lot of contagious organisms that are actually not pathogenic to the cat, and we may test and find them positive, but they don't actually have diarrhea because of that pathogen. So it makes it very challenging for veterinarians.
Yeah. And I think in the podcast with Susan Little, she mentioned that cats have only 5 symptoms, and diarrhea is one of them. So they use that as a symptom for quite a lot of diseases.
Yes, they do. And I think Susan also mentioned, that we do see cats with sickness behavior. So diarrhea or gastrointestinal upset can be related to stress or anxiety. So we always have to have that on our radar as well as medical diseases.
Yeah. So if we follow the cat in through the door and maybe through the workup, we will of course first meet these in maybe over the phone or as I'm a first opinion practice, so I would likely have the first talk with the owner and try to get a thorough anamnesis.
Sure. Yes. And I think even before we walk in the room, just knowing the signalment of that patient, so for example, how old they are, is going to have us thinking about certain things that might be wrong with that cat. So in cases of kittens, they're more likely to have certain conditions compared to, say, an adult cat or a senior cat that could be causing diarrhea. And then we also may see certain breeds that we know are predisposed to things like inflammatory bowel disease that causes diarrhea, ragdolls being one that I see for it quite often. So, obviously going into that room with any condition, a veterinarian has some preconceived ideas based on science, information, and our experience. But the history is definitely going to be very important. Definitely we want to find out how long the diarrhea has been going on for. And this can actually be a difficult thing to assess with clients because sometimes the cat may have had on and off diarrhea for a long period of time, and they've finally decided to bring the cat in. So we really have to dig deep to find out the history of that cat's diarrhea. It might have been a month since it had a bout last, and they're now bringing it in because this current bout is lasting 3 days, and now they're worried. But that still is a sign there's a chronic problem. Or they may never have had diarrhea before, and suddenly in the last 1 or 3 days, they're bringing them in.
Yeah.
So we definitely want to ask about how long it's been going on for.
But I think when I read in the books and the papers, they try to divide these up in chronic and acute, and I have a little trouble putting them into one or the other because I'm not. Yeah, well, I know the chronic is usually a little bit longer than acute, but is it acute if it's recurring within, let's say, 3 months, or how do you divide these, or is it even practical to do in the clinic?
That's really a good question because when you and I started talking about doing this podcast, you asked about the chronic versus acute, and certainly when you look in the literature, you can find numbers like 3 weeks if the diarrhea has been going on for over 3 weeks. Even if it's intermittent, they would call it chronic. But then when I sit down and try to say to you, oh, well, if it's chronic or acute, I might look at these different things. There actually really isn't very much different that I would look at in terms of acute or chronic, because acute can very easily become chronic, right? And most of the causes for diarrhea in cats have the potential to become chronic. And again, when we dig in the history, we may actually find that that's the case. Mm-hmm. So it is kind of almost academic in a way. It's still good to know, but maybe academic.
Yeah. Okay. And what else do you dig for in the history?
One of the things I will like to ask about is obviously the lifestyle of the cat. If they're exposed to other animals, cats, dogs, do they go outside? First and foremost, I will check and find out also if the cat has parasite prevention on a regular basis. That's a highly overlooked situation with most cats because, at least in North America, a lot of cats are kept indoors and people assume that that's a safe place and that the cats will never get intestinal parasites. It's a really negative or incorrect assumption. So that in and of itself is a potential cause of diarrhea. So I always want to find out about that. We'll also look at anybody coming into the household as well, even if it's a strictly indoor cat. What sort of exposure was the cat exposed to? Any toxins, or are there plants in the household that the cat might be eating that could cause the diarrhea? I also will ask for a fairly detailed history about the cat's diet, because if they've changed the diet recently, then maybe that's the reason. Maybe they've had the same giant bag of food that they bought on sale for 6 months and it's gone off and now the cat's sick. So there could be some simple explanations for why the diarrhea is occurring based on that diet history. The diet history also is important in case the clients have already been fussing around with the diet at home. So in this day and age of Dr. Google, when people are looking symptoms up online for themselves and for their pets, the cat may have already had diarrhea for some length of time, and they may just be trying different things at home. So they might try some over-the-counter remedies. They might try switching diets, depending on what kind of advice they got online or at the pet store. Mm.
And sometimes we actually have to take the owner a little step back here just to re-educate them, and because some owners I talk to have a preconceived idea of what a previous disease was, and then they don't actually mention it and they just write it off. Now, yeah, we gave it that and we know that it was that, so don't consider that, just focus on what we have today, and that can be challenging, I think.
It can be challenging, and that happens often because they're self-medicating, or rather medicating their pet at home, and assuming that they've either done it correctly or that it's not an issue, as you say, because they've done something to try and deal with that potential differential in terms of what's causing the diarrhea. So yeah, getting that history from the clients is really critical, and educating them that there are some things we need to do with proper medications that are safe and effective. So I guess deworming would be a good example of one of those things where the client can probably purchase dewormer over the counter. In North America, we certainly can. And they may have already dewormed their cat with something and think that they've cleared the issue. I hear a lot of times people using things like diatomaceous earth. They find that on Dr. Google as well, and wonder why the cat still has tapeworm, for example. So those things don't work, but they think they will.
And how important are the parasites actually for the diarrhea? Maybe it's a little bit of a tangent here, but I think I read somewhere that cats usually don't have any symptoms of just a mild parasitic burden.
Yeah, that's absolutely correct. So they could have intestinal parasites, and that may not be the cause of the diarrhea. But my argument always is that we don't want anything going on in the cat that could be contributing to the diarrhea, or vomiting if we were talking about vomiting. So for me, having an up-to-date parasite prevention is critical to making sure that that as a differential is off the table as a possibility. And so it's one of the first things I do with both vomiting and diarrhea cats when they come into my practice, if they're not already on something. Yeah. Which most of my patients luckily are.
Yeah, and we will quite quickly go into a political debate here, because here in Denmark we don't use preventative medicine as much, and we have regulations around that. So it's a bit a gray area, and we don't have over-the-counter products for deworming in cats here in Denmark. It's some vets sell them without a diagnosis, and some are more restrictive, but usually if they have something, it's because they have it from a vet.
Yeah, and that's good. I wish that we had that same situation here, because it can become very challenging. Even if clients have access to good drugs over the counter here, they're often using the drugs incorrectly. So for the incorrect amount of time, or maybe they underdose, they didn't read the package correctly. And so that sounds like a really good rule that we should have in Canada.
Yeah, well, the clients are not always that happy about it, but yeah.
Oh.
Maybe that's a talk for some other time.
Yeah, maybe.
Yeah. But okay, so that's deworming. So
yeah.
Let's say you have dewormed the cat, or maybe the owner has. If you feel that the owner has done it correctly, how do you move on from that?
So as long as that's not on our radar, with a cat that's maybe presenting with a first-time presentation for diarrhea, it's a young cat, some of these diarrheas can be related to unknown irritations or stress or anxiety. We talked about sickness behaviors, and a lot of them are self-limiting. So depending on the type of diarrhea the cat's had, and really if it's just acute, then we'll potentially just send them home with a bland, easy-to-digest gastrointestinal diet, and wait a couple days and see how they're doing. So I do also ask the clients about the fecal quality. We want to know about the fecal score. And I know Dr. Little spoke towards this a little bit, that all of the pet food companies have fecal scoring charts. The one we use here currently is the Royal Canin fecal scoring chart, and it helps us to identify how loose the stool is. And also when clients take those charts home, they can relay that information to us as well. And then, of course, we want to ask about whether they're seeing frank blood. Are they seeing mucus? How often is the cat going? If so, we want to try and differentiate between a large bowel and a small bowel diarrhea if we can, because that might point us in the right direction as far as the diagnosis goes, or what to look for testing.
Yeah. I do have a podcast episode planned for the for the difference in large and small bowel diarrhea. But can you please give us a short overview?
Sure.
How do you see on what's coming out, where it comes from?
Sure, I'm thinking a whole podcast on that. Must be. I want to listen to that one, Soren, for sure.
Yeah, it's going to be in Danish, but you're welcome.
I'll do my best. So some certain parasites and infectious disease will affect the small bowel. Inflammatory bowel disease can infect either large or small. Some infectious parasites will affect the large bowel. So if we can ask clients about how frequent the cat is going, what we'll see is that very frequent volumes during the day is going to be more likely associated with the large bowel. And then if the cat is straining or has what we call tenesmus when they're going to the washroom, if there's an urgency and also difficulty passing the stools, then we're potentially going to be seeing large bowel. The other thing clients might notice if the cat hasn't completely covered the diarrhea with the cat litter is that the stool is shiny, which would indicate there might be some mucus there, or they may actually see mucus passing. And they may also see fresh blood, which is going to be more likely from the rectum or the colon as opposed to up in the small intestine. So then, if we're looking at small bowel diarrhea, it tends to be less often in larger volumes, simply because it's an issue of the volume of stool building up in the small intestine and then overwhelming the colon, and the stool comes out in a larger volume. Obviously, you're less likely to see frank blood in that case. So you may see digested blood, which we all know to be called melena. Mm-hmm. And then there may be more things like gas passed from small intestinal diarrhea as well. And they may have some fat in the stool or changes in coloration. In either of those cases, of course, they also could be vomiting.
And what will that change in? You say you're going to probably send them home with some kind of diet. Is that going to change what you recommend?
It might not change that in the early phases, unless we're seeing a lot of blood or something that's concerning me about the cat's status in terms of stability. So as long as my physical examination is not showing any dehydration, pain, fever, frank blood being observed in the stool in large volumes, and probably it won't change it greatly. And again, also, like you said, we've covered for parasites, so or the general parasites that we expect to see.
Yeah. And just maybe a quick question. In dogs, we would usually use rice and chicken or cottage cheese or something. What do you use if the owner wants to make something themselves?
I actually generally don't recommend that clients make foods for their cats at home, even for short-term use, I guess, because of the balance issue in terms of the amino acids that they need and the essential fatty acids they need in their diet. I usually will prescribe something like Hill's Intestinal ID diet or Royal Canin Gastro. Those are easy. They come in dry. They come in cans. So they're options that the client can take home and use. And I find those help very well and makes it a little easier for them than having to cook.
Yeah. Good. So that's a bit of the history, and you mentioned temperature, of course, but is there anything else that we should especially focus on in the clinical examination?
Yeah, so most of the time when these guys come in with diarrhea, we're not going to find a lot of abnormalities, especially if it's a fairly recent problem. But I do look for signs of dehydration. So if they have been passing large quantities of stool for a certain length of time, they may not be able to keep their water content. And so they could be dehydrated. They may have changes in their mucous membranes that are indicating dehydration or blood loss or even jaundice. If something is going on, like say feline infectious peritonitis, we might have changes. And then I'll look around when I take the temperature. I'll look at the area of the perineum for any signs of soiling, and I might get more information about the diarrhea simply by looking with my own eyes, but also to see if there's any prolapse of rectal tissue or anal sac problems, which can occur in cats, although they're not very common, and may or may not be associated with the problem. Mm-hmm. When I'm looking at their abdominal palpation, I'm definitely checking for any evidence of pain, gas, and checking the intestines to see how they get a sense of how they feel in my hands. So do the intestinal loops feel thickened? Also, are we feeling any masses or enlarged lymph nodes? Because in certain cases, you can certainly detect lymph nodes that have become bigger with inflammation or some other condition.
Yeah. Yeah, but I think cats are usually easier to examine on palpation anyway. If it's a nice cat anyway, but easier than a dog. I find I usually find that I can feel more details in there.
Yeah, you can, and partly because they're smaller. I think, especially if we're considering large breed dogs, they're harder. We do have some cats who have painful abdomens that will tense up their body wall, and then those cats probably need some pain medication. and then I'll try to re-examine them. So we might give them some buprenorphine or gabapentin and then wait about half an hour and check them again.
Yeah.
And that helps a lot.
And aside from pain and maybe masses, do you find anything in there that usually gives you a hint on to what's going on? Or you mentioned gas, tight loops of intestine.
Yeah, so depending on the age of the animal, sometimes those things will tip me off. So a kitten with very ropey intestines where they feel firm, and those kittens may have intestinal parasites like roundworms, and you can sort of sense that there's no give to the small intestinal loops. And then, we just had a cat the other day who's lost some weight inexplicably, and she had very sort of ropey intestine, and I know she's on parasite control, and she looks like probably lymphoma of the intestinal wall. So you'll sometimes start to feel that thickening of the intestinal wall in those cases. But that's really can be very subjective and would depend, again, like I said, is it a kitten? Is it a cat with chronic weight loss? That kind of thing.
Yeah. So it's basically to rule out any obvious masses or foreign bodies or anything obvious.
Yeah, exactly. So it isn't always going to tell you everything. And I do like to know if my patients are nauseous or in pain. So the client may not be seeing vomiting associated with the diarrhea, but if you are feeling or the area of the pancreas or the stomach or certain areas of the intestine and the cat is licking their lips and maybe swallowing, that could be a sign that they also have a nausea component to their problems.
Yeah.
So that helps as well. And then again, if they're painful, we want to know that because we want to start them on pain medication.
Yeah.
I think cats don't show pain very well at all. And we all know that gastrointestinal problems can be quite uncomfortable and painful at times. So we really want to try and address that if we can for those patients because they'll feel more comfortable.
So I'm guessing at this point we have to make a decision whether to send the cat home or to try to talk the owner into letting the cat stay at the hospital. Is that about right?
Probably, yeah. Or sometimes we'll send the cat home for the owner to collect, say, a fecal sample for testing. So we might be looking for something like Giardia, Trichomonas, and even intestinal parasites like coccidia are less common, but we do see them from time to time. And then it really would also depend on the age of the cat. So if that cat is actually presenting and they're overall stable, they're not dehydrated or very little dehydration, again, we may send them home with the diet and some diagnostic plans, or we may collect blood from them at the time of their visit. So, for example, if I'm looking at a middle-aged or young adult to middle-aged cat, I may suggest that we do some blood work. So we may want to look at things like signs of diabetes, kidney disease, thyroid problems, because all of those things can upset the GI tract. So we're going to want to look at whether the cat is stable in all those other areas as well. And most of the time, if these cats have been having diarrhea long enough, I'll also want an updated feline immunodeficiency and feline leukemia virus test updated. Because one never knows when those things are going to pop up.
No, of course. And I wouldn't actually think of those as obvious reason for diarrhea, but they can maybe send the immune system off balance, and then they could be susceptible to anything else. Yeah.
So anytime I have a sick cat, I always try to find out their most recent status, because even if that's not the direct cause of the diarrhea, it certainly, again, is one of those things that could be contributing. It's also going to impact how we deal with that cat, right? We're going to be maybe a little bit more aggressive about providing treatment and diagnostics to that cat if we know they're potentially immune suppressed.
Yeah. At this point, if I'm going to send the cat home, or even if I'm going to keep it, I have to decide on a medication to give it. And you mentioned a pain medication, a buprenorphine.
Buprenorphine, yeah.
Yeah. Oh.
Yeah.
We have that as well. I can say it in Danish, but
it's a lovely pain drug.
Yeah.
Yeah.
Would you use NSAIDs for that, for GI patients?
I might use NSAIDs for the GI patient. It would really depend on the situation. And if it's an older cat and I'm not aware of their kidney status, I may be a little more hesitant. So the NSAIDs are wonderful anti-inflammatory pain management drugs, but if there are other components to the pain that narcotics or say gabapentin might help, then I'm going to likely reach for those first. I do try to practice multimodal management. So if we're admitting a cat and we think it's painful and sick enough from diarrhea, they're probably going to get more than one of those drugs for pain, for sure. Yeah, and then so, other medications that we might give would be fairly limited, at least at the beginning, because I'm going to want to try and target the treatment of the diarrhea to what the cause is. So there isn't anything that I would give other than the pain management. We might start that cat on that bland diet if they're dehydrated, the intravenous fluids. If they're nauseous or don't have an appetite, then we want to try and stimulate their appetite and treat the nausea. So we'll do all of those things and then try to get to the bottom of the diagnosis with them. We do use things like fortiflora, so probiotics as well, which do help with some patients.
Yeah.
Yeah.
And for the appetite stimulant, would you use that for outpatients as well, or just inpatients?
We'll use it for outpatients. So if we do think it's a concern that they need something to stimulate their appetite, we will send home doses of mirtazapine, which is our drug of choice here at this moment, and with recommendations to give every 3 days to stimulate appetite. The nice thing about mirtazapine is it does have some anti-nausea effects, but we'll often also send home Cerenia if we think they have nausea as well. Yeah.
Is that, we have other possibilities for the nausea as well, but the Cerenia is one of the drugs you use?
Cerenia is probably the first thing that I'll reach for nausea in cats. We have some cats that have some pretty severe nausea with pancreatitis, and we will often also give them ondansetron, which is a high-end anti-nausea was designed in humans for people who are on chemotherapy. It's strongly effective. So it's a nice drug.
Also.
Yeah.
And we talked a little about, before we pressed record here, not to open up the Pandora's box on antibiotics, not too much anyway, but you say that's basically what you give, and you didn't mention antibiotics. So maybe we should touch on that as well.
Yeah, that's like the elephant in the room these days, antibiotics. And so it is very common for clinicians to reach for things like metronidazole or tylosin to treat diarrhea as one of their first or second line of treatment if they're not getting anywhere with, say, a food change. And I sort of tried to avoid those drugs as much as I can, simply because when we're using those drugs, we're really upsetting the intestinal flora. And while it's true that probably with the diarrhea, the intestinal flora is already disturbed, I think sometimes we do more harm than good with those antibiotics. And so we end up in a potentially worse situation. It is true that sometimes the cat's diarrhea will resolve, but then the question always is, was it going to anyway? Because a lot of times these are self-limiting. It's kind of akin to putting a cat with inflammation of their bladder or cystitis signs on an antibiotic without a urine culture. If you assume it has an infection, that cat was probably going to get better anyway, and then people think the antibiotic fixed the problem, but it didn't really. Yeah. So we don't use tylosin here in my practice at all, but we do sometimes reach for metronidazole in certain cases of older cats with chronic diarrhea.
Yeah. And we don't have tylosin here in Denmark, not anymore. We used to, but we don't. And we would usually use amoxicillin or I don't know how to pronounce that. Sorry, or a first generation cephalosporin for usually first line products if we do use anything.
Yeah, and those are probably commonly used here as well. I think like Clavamox, which is your potentiated amoxicillins, cephalosporin.
Actually, I don't know how to put this, but it takes maybe take some courage from the clinician to actually talk to the owner about the use of antibiotics, and I think there's always a fear that the cat maybe go into sepsis or you didn't do enough, and you have to give it everything you got, and then you just pour on drug after drug, and we will have to change our minds a little bit on this.
I think we really need to, and as the professionals in the equation, it's our responsibility to make sure that we're not prescribing antibiotics when we don't have proof that they're needed. And then diarrhea is a perfect case of that. And sure, if there's evidence of toxic bacteria, we've done a fecal panel and we know that the cat's got something particular that needs a particular antibiotic, that's okay. But we do need to be able to explain to clients that we are running out of antibiotics for human use. And nobody wants their family member or their child to develop a resistant infection and not be able to be treated for it. And this is where we stand. We are the gatekeeper really to preventing those things. And we've already let too much go through. So you're right. We have to be able to feel confident in our ability to say, no, this is not the right choice of treatment at this moment.
I do have to say that we have quite a good help from the media here in Denmark and Scandinavia in all, because there have been a lot of talk about antibiotic resistance. So if I say to the owner that we can actually make your cat better without the use of antibiotics, wouldn't you prefer that? And people will usually say yes, of course we don't have to use medicine if we can fix it without it. So you can actually maybe turn it around and make it sound like you're doing them a better service without.
Sure, and the funny flip side to that is that when we're providing those probiotics, we're actually treating someone's cat with bacteria for diarrhea, which works often, or if we're doing things like fecal transplants, again, we're providing that cat with bacteria. So really, antibiotics don't have a large role in that immediate diarrhea issue unless we have proof that there's a bacteria there that needs treatment. They actually just need a readjustment of their gut.
So you would actually have to have a culture that shows salmonella or campylobacter or something.
Most of the time, I still fall back occasionally on metronidazole, which I will admit, if I'm not getting anywhere with my usual rounds of food changes and making sure the parasite control is up to date. We do use a metronidazole occasionally in those cases. And it does it's not so much for the antibiotic effect of the metronidazole, that it's anti-inflammatory properties, that it changes the way things function in the gut. So it does impact diarrhea that way, but it also has a huge impact on the normal flora of the bacteria in the gut. So I kind of try to avoid it, but I will still use it. It's just not the first thing I'll reach for.
Okay.
The other thing I'll say to clients is that we don't want to reach for 7 things all at the same time, because we're never going to know what worked, right? So as long as the cat's stable, it's not a bad idea to take a stepwise approach and try one thing, and then if it doesn't work, then try the next thing. Because if you just do 2 or 3 things at the same time and the cat gets better, how do you know what you were treating? And 3 weeks down the road, when the cat develops diarrhea again, you're not going to know where to start. You're back at square one. Mm-hmm. So I try to go one thing at a time.
How long would you go between each? Or maybe that's a difficult question to answer just in general.
I think in general, like if we start with just the diet, for example, I would expect the cat to have some resolution within a few days to a week. So our technicians, or I guess you maybe call nurses, will be in close contact on the telephone with the clients every other day or so and asking for the fecal score and how the cat's doing. And then if we're not seeing a change, then we'll say, okay, well, maybe now we need to take this next step.
Yeah. So the step-by-step approach would actually be diet quite early in the treatment with the probiotics and maybe pain medication plus minus.
Yeah, a lot of these younger cats don't seem to have a lot of pain, but for the older guys, they may, or if they've got severe diarrhea, hydration if they need it. But yeah, the diet would be my first step. Again, assuming parasite prevention is up to date, because I'll always want to get that going as well. Yeah. So then if the diet's not working, then I actually start collecting samples at that point. So if it's not a senior cat where I want it already done my blood work, I might get the client to start collecting fecal samples into preservative containers where we can look for Giardia or other ovid parasites that may not be in that parasite control. And then I'll use for PCR if we needed to go that route for checking for, Clostridial toxins or salmonella. Those are tough tests to run because the results can be misleading because a lot of cats have some of those agents in their systems anyway and may not be the cause of the clinical signs. Yeah. So if you're going to run those PCR tests for Salmonella and Clostridium, Campylobacter, you kind of have to really decide if a positive test correlates with the exact clinical signs. And if it doesn't, then it's probably not significant.
Good. So the cat is still having diarrhea, and we end up drawing some blood, and we rule out the most common endocrine problems and maybe liver and kidney disease. What do you look for in the blood sample that will actually get the focus back on the GI tract?
Depending on how long the condition's been going on for, at that point I might start looking for things like exocrine pancreatic insufficiency in adult cats and even some kittens, signs of low B12. So intestinal disease, intestinal wall disease, inflammatory bowel disease. In the older cats, that might include small cell lymphoma or even large cell lymphoma in the intestinal wall. So we will look at those values. And some of these cats will come back. They have exocrine pancreatic insufficiency. Their TLI is low. And that's something that we know we can treat with enzymes. So that's definitely part of that gastrointestinal panel. In Canada, we send to the Texas A&M University. It's the only place in North America, I think, that runs those tests currently. Mm-hmm. And a lot of these cats, if they come back with a low B12, it's a high indication that they have intestinal wall disease, pancreatic disease, and we work them up from there.
Yeah. Do you run the specific pancreatic enzyme as well? I do include that in my test. And so that test in and of itself will run a patient side, the colorimetric test, which just shows a color change. And if that's positive, then we will send it out for a numerical value to see how high it is, because there's a gray range in that test that doesn't tell us a lot of information. The problem for that test is if it's normal, it still doesn't rule out pancreatitis. So we have to make sure that the client understands that it's not 100% sensitive. Yeah.
And the TLI sometimes helps because with some of those cats with pancreatitis, the TLI will also come back elevated. But again, not a sensitive test for pancreatic disease. I don't think we have a sensitive test for pancreatic disease, really. No. So we have to kind of gauge the information we have for pancreatic issues.
Yeah. And in dogs, you would usually go in to take a piece of the pancreas if you're frustrated enough anyway. Would you do the same in cats?
Depending on the situation, I might suggest if we're considering intestinal wall disease and pancreas that we get an ultrasound first. So as a less invasive information about the intestinal wall. And again, unfortunately, with ultrasound, pancreatic information is variable depending on the operator and experience and a lot of different things. So it also can't be diagnostic. But really, when you think about it, if you go in and biopsy a piece of the pancreas, there's multiple limbs to the pancreas. You could miss something even doing that. So we do occasionally take cats to exploratory. And of course, then I will take biopsies of pancreas, but also make sure we get liver and multiple biopsies of the small intestine and lymph nodes. Yeah, and stomach.
But depending on what expert you ask, they would use. Some would go for the endoscopy biopsies first, and then maybe onto the full thickness biopsies after that, and others would do the other thing other way around. Do you have a preferred step you start with?
Yeah, well, first of all, I don't have easy access to endoscopy in my practice in the city that I live in, so it's not something that I can do if I wanted to. I do like exploratory for the types of diseases I'm seeing in cats because I can actually then get biopsies of everything. So with your endoscopy, you're getting biopsies of the inside of the intestine, but you're not getting full thickness, and then you're not really able to biopsy or even look at any other part of the abdomen in terms of the abdominal organs. So taking a biopsy of the pancreas, taking biopsies of the lymph node. You can't do that with endoscopy. So I prefer to do exploratory, but obviously that also comes with a lot of morbidity. It's a more severe and also invasive procedure than endoscopy is. Yeah. So yes, you can get a diagnosis with endoscopy of small intestinal disease. There's just, you don't get as much information.
No, of course. So is that basically the step-by-step approach to the cats, or is there anything that we overlooked here?
I don't think there's anything we overlooked. I think there's so much variation on how you proceed based on the age of the cat, the history, and what you might find as you go along the way, in terms of what's going on with that cat, whether the diarrhea resolves or not. And so, we have some cats, for example, young adult cats that might present with diarrhea, and we think they have Giardia, and we try to treat that, but then they get diarrhea again. And some of those cats end up having more significant issues like granulomatous locations of FIP in their colon, like the diarrhea that lasts for a year and a half before they get really sick from the feline infectious peritonitis. So it's really a trail you go down, and it can be very frustrating. I consult on the Veterinary Information Network and chronic diarrhea, and what am I supposed to do with this diarrhea case is a problem I see a lot on VIN with other veterinarians. It's not easy, and it's frustrating for owners. It's messy. The cats can have accidents. The cats get feces on their fur and on the furniture. And so it can be very frustrating both for the owners and the clients if we're not getting anywhere despite doing this test and that test and trying this food and trying, that drug. And it can be very difficult because they're paying money and they're not getting anywhere. So sometimes we might try to use diets other than the easy to digest diet. So we might decide to try a hypoallergenic diet, and that maybe that cat has a food responsive or dietary sensitivity that works. And in some cases, when we can't afford to do endoscopy or biopsy and we think there's intestinal wall disease, then maybe we're going to do steroids and, take that chance that the cat is going to respond. Mm-hmm. But then, of course, we don't have a diagnosis, so that cat's probably going to have to stay on those steroids long term.
Yeah,
that happens a lot. I mean, people have limited funds for a lot of these tests, right? So
yeah. And that's actually, there's 2 points hidden in here, because as I'm working in first opinion practice, I like to somehow make sure that I haven't overlooked anything, or I'm using the money correctly. So that's two sides of the same coin. That it's better to think deworming before starting blood samples, I can hear you say, and it's a good thought just to have a basic profile and some of the other values in the blood before you jump to ultrasound and basically from there, that will be a referral patient. I think I will try to send it out to a colleague at that point, but and then let someone else decide. But as much as practical I can do in my clinic, that's always better, I think.
Certainly, and if you have access to the gastrointestinal panels like the B12 and the folate testing, that's valuable for a general practitioner. For myself, I'm in primary practice as well, because we know a lot about the B12 as being really important. If the cat has a low B12, we need to get that cat back onto the B12. So we need to either use injectable B12 or oral B12 to get that level back up, because if we don't, those cats actually aren't going to respond as well to a lot of the other treatments we prescribe, because their system's down and out from B12 depletion. So even those tests are easy enough for most practitioners to run as part of their blood panel, and having that information is really valuable. There's a lot of information on the Texas A&M University site on B12 and folate, and I can certainly provide the links to hook up to your webinar for that. Yeah,
links will be in the show notes as well, so people can find them there. Good, Kelly. I think I'm running out of questions here. So if you don't have anything else important just here and in closing, I'd like to ask you, where can people find out more about you, or maybe have a look at your clinic's website?
Sure. Our clinic website is at www.charingcrosscatclinic.com, which is rather misleading because Charing Cross is a subway station in London, but we're located in Ontario, Canada. And there is a contact us link on the website. But if veterinarians wanted to contact me with any direct questions, my email can be provided, but it's Dr. St. Denis at charingcrosscatclinic.com.
Okay.
All lowercase.
I'll, of course, make sure that's in the show note as well. So
sure. Yeah.
Thank you very much. It's you've been very helpful, and I hope people will bear with my pronunciations. So hopefully it wasn't too hard for people to listen to. But you certainly delivered a lot of value, and thank you for doing that.
Well, thank you, Soren. I really enjoyed myself, and I'm happy to have the opportunity to chat with you like this. It's great. Thank you.
Husk at få din GI Handyguide PDF over på hjemmesiden. Det er det samme sted, som du finder links og noter til det, vi har snakket om i dag. Det er i shownoterne på SIVP.dk/85. SIVP.dk/85. Tak for i dag. Vi høres ved igen på næste søndag.